Yeah, so I think we are currently in that space where wearable technology becomes, you know, part of society's everyday life. So better point of care and wearable tech or blood pressure devices, which also are validated for children, could revolutionize screening and also help with risk mitigation if detected earlier. In the next decade, I think combining smartphone-based monitoring with AI-driven algorithms, risk algorithms, could personalize prevention. But there's a need for robust pediatric reference data in order to, extrapolate this or these algorithms to the pediatric context. This is even more critical in the African populations since we have a massive data gap in terms of blood pressure in Africa. But I also believe that policy level interventions to promote cardiovascular health preservation is one of the critical areas where future breakthroughs can definitely improve hypertension risk in this younger population. Thank you for that question. I think, in terms of big data, that machine learning can help us uncover, subtle risk patterns, for example, diet and blood pressure links from large cohorts. AI tools might also help to assist in reading ABPM trends, ambulatory blood pressure trends, or even microvascular retinal images to improve early risk detection. But these algorithms require high quality and representative data. And, in Africa, for example, these data are still emerging, and also in other parts of the world, these big data sets are still emerging. So challenges include data privacy and the need for clinical validation of these models, and also ensuring digital tools that are accessible to resource-limited clinics or settings. So I think interdisciplinary collaboration, clinicians and data scientists need to work together to advance this field responsibly going forward. Yes, I would suggest, focusing on cardiovascular health preservation and early detection and prevention of non-communicable diseases, which will include, high blood pressure or hypertension as a risk factor for non-communicable disease, especially cardiovascular diseases. I would also include invited reviews on child or adolescent hypertension, epidemiology, school-based screening programs across the globe, and also the impact of diet, especially in low middle income countries, to understand those nuances in terms of how, access to better and to poorer diets can contribute to elevated blood pressure. And I would also recommend topics on digital health, AI, telemedicine, and also genetics in hypertension, and especially from, underrepresented populations, for example, in Africa. So I think a mix of clinical perspectives and global health policy would also deepen such an issue in the journal.